So I think some personal reflections really over the last few hours. It is quite interesting that, as Andy Burnham and others routinely articulated earlier, that we're still somewhat depressingly, if you excuse the pun, trying to articulate arguments for the need to focus on mental health, to the exclusion of other elements of health, which, as Andy mentioned earlier, are things like cancer and so on. They're accepted arguments, and yet we still have to have conference settings and indeed policy discussions to help ensure that mental health remains, or it is more of a policy priority than it is currently. And that's quite interesting, that you almost have to articulate that more clearly. One of the key characteristics of not only our partnership, but indeed partnership working across the health sector is collaboration. In an era where people are jostling for position to demonstrate impact and evidence, all too often in the market, as Andy referred to earlier, the real philosophy behind partnerships actually get lost. And I think certainly if you're trying to improve mental health generally across sport, then one of the central ideas is not only the personalisation of services, but also to embed social capital and relationships and social connectedness across communities, within communities, using sport essentially as an opportunity to do that. And I think that's been one theme that has been clear throughout each of the sessions so far. So I think collaboration is clearly important, and identifying what partners are appropriate in some cases and rather than in others, whether that's for funding purposes or indeed for actually getting access to hard to reach communities. And I think the examples that we had from opening up cricket, but also from Everton, where some of the sports clubs that we have do give us an opportunity actually to reach groups or potential service users who aren't actually engaging in mainstream services. And I think those are the kinds of opportunities that we have by working with colleagues here. One of the particularly powerful things which characterise not only the partnership, but I think Simon articulated this very clearly in relation to the work that CALM do, is actually drawing on the particular brands of organisations that are culturally appealing to the people whose behaviour it is you're trying to change. So Simon made a particular point and play on the ways in which you identify particular groups of people and actually market and brand the services which you're talking about to those particular groups. So we've talked a lot about men, and indeed one comment that I thought Mark and indeed Johnny mentioned earlier was actually about how do you tailor services to women. But men and women, of course, are not homogenous people. We do need to look at older populations, younger populations, white groups, other minority groups. And we haven't really delved into the detail in that today, and indeed we would probably need a week's worth of conferences to do that. But also the ageing population, whether they're in through the middle age, 40 to 50, but also 70 and 80-year-olds who are at risk of social isolation, which was a theme, of course, which we started with social housing. And of course, sport has particular relevance to them, whether it's in the context of isolation, but also in the context of things like depression, anxiety, and social disconnection rather than connection. So I think there are ways in which we can use sport to engage those communities. One thing which I know Simon is at pains to emphasise, and indeed many other colleagues are in agreement, is that we need to focus on prevention as much as cure. And by prevention, I think we're working in context, certainly in sport and physical activity, where you can actually use sport and physical activity in a preventative way to raise awareness, to identify services, and to anticipate conditions or problems before they actually develop in the first place. It's far more cost effective to be preventative than to be curative. And I think that is something that for people in the room to actually reflect on, to think of ways in which we can actually be preventative in the way that we use sport and physical activity. And certainly the examples that Mark identified and Johnny indeed articulated about the partnerships work more recently of actually adopting a personalised but also preventative approach, I think. Because until now, colleagues at Everton and then more recently opening up have gone out and worked with people who perhaps have already developed these kinds of conditions, and that is important, that work needs to continue. But perhaps to increase the impact, we also need to look at ways in which we can reflect on the lessons which could be learned from service users and people who are experiencing mental illness, and then how you can use that to develop a model of prevention. And I think if you're to win the argument in political terms and policy circles, you need to argue the economic benefit. Whether they buy the mental health argument is, at one level is neither here nor there, but if you can get the ears of the economic elements, then that's important. And in many respects, sport is quite cost effective actually. It's fairly cheap to governments and it's fairly cheap to policymakers. And it needs, however, to be presented in the right way. We've talked about different kinds of sports and we've talked about physical activity, but the ways in which sports work for particular groups will vary. So rugby will vary in different ways to cricket, to football, and then to more individualised sports. And I think there are opportunities there for us to think about how different sports work for different groups of people at different stages in their lives. And beyond sport, actually, the other thing which we need to be careful of is not to conflate sport with physical activity and exercise, because certainly most of the evidence is actually strongest in relation to exercise or physical activity in terms of its impact on the management of conditions like depression or anxiety. Where the evidence is strongest for sport is generally in terms of its cross-cultural appeal and its cultural significance in many people's lives. And it's important, I think, that we reflect on that. Sport, in many respects, is the flypaper, like in the case of Everton, or indeed in opening up cricket, and in non-sport settings like Calm. It's a brand which attracts people to the programmes that you're developing, but you then need to change people's behaviour within those kinds of programmes. And it's important, I think, we give due emphasis both to the design of programmes, to the branding of them, but also how they're delivered and with whom and in what ways. So I think in terms of some of our kind of future plans, we're very keen to work with other colleagues who share a similar kind of vision to us, and opening up cricket is a perfect example of that. They're some of our more recent partners that we feel particularly pleased and proud to work with, but also to integrate those into existing sets of relationships where knowledge can be shared and where resources can be pulled to have the kind of impact that we wish to have. And today's event is one example of that. We're certainly hopeful that we can offer similar support to other colleagues like Jake, who are also at different stages of developing charities that may or may not seek to develop awareness in mental health. So I think the emphasis there is quite important, and we're keen to build that momentum in research and teaching. And in many cases, our philosophy as an institution, but also with our key partners, is to develop professional development activity as well as actually longer term projects that students and other colleagues who work within the industry can actually undertake to develop their own expertise, and indeed that will be reflected hopefully in a number of developments that the department wishes to make from September of next year, most notably a postgraduate programme in sport, physical activity and health. And indeed the partners that are represented in the room today and colleagues who have attended will be very welcome, of course, to be involved in discussions about how that programme unfolds and how it develops to meet the needs of the people who have been represented here today. It's not simply in relation to sport. Mark has already mentioned very briefly the work that the university is actually funding for postgraduate students to undertake, not only with opening up cricket, but also with Everton and the community. And indeed, we're very pleased that with the support of Everton, we will be appointing a full-time researcher to work on mental health-based projects in January. And that will be to broaden not only the lessons that we've learnt here, but also to embed the programmes into all their existing relationship. So if people are keen, of course, to hear more about that, I'm sure we can discuss that later. I think the final two things really relate to the longer term outcomes of this particular conference. We're very keen not only to do one-off events like this, it's very easy actually, even though I wasn't thinking this at 9 o'clock this morning, to host conferences, and I still don't think it. But actually we want a series of follow-up developments that actually makes meaningful impact and change, that are driven by colleagues in the partnership, but also others who have an interest in this. And to that end, we will be making all of the presentations that have been delivered today, as well as all the slides and additional supporting research available publicly and freely on our website in the next week or so. And we will, of course, inform colleagues who provided email addresses either when they registered or today when they arrived, of when those resources are available, because it is important that certainly those of us working in the public sector are generally funded by public funds, and those funds should be used to greatest effect to affect the lives of as many people as possible. It's also good teaching resources, so the students in the room, you should be writing that down for your assessments. So yeah, you might pass if you do that. But that essentially is the philosophy, that evidence which can be used, which is important, and not just in terms of the stats and figures, because I think we've outlined those very clearly this morning, but actually to report on stories and programmes that work. What works for which groups of people and for what reasons. But also for perhaps what hasn't worked as well, what lessons can be learned from projects that we've been involved in or from our partners have been involved in, that could then benefit other people. And I think one thing we will look to do is to invite testimonies, discussions from colleagues who are working in service areas and policy areas, to actually upload lessons and sharing of knowledge that can actually be used by other partners who we work with to broaden that impact. So it is open access, it isn't exclusive, but it is nonetheless evidence-based, it's rigorous, and I was very encouraged to hear Andy Burnham in particular make mention of the ways in which the insight which might be derived from programmes that are already running by Everton, Imagine Your Goals in particular, pass on the memories from the Dementia Project, is actually being used and being recognised by people who have influence, who shape policy, who have an opportunity to inform discussions of funding. And I think that's an important conversation to have. We might not necessarily agree with everything that is said in policy terms, but we need to flow with the policy talk. On a broader level, we're keen and we're very grateful for the support that the university, and in particular the department, continues to give to us in terms of the mental health training that it gives to not only our students actually, but also to members of the Students' Union, our halls of residence officers and our community partners. There will be, I think certainly by the end of this year, we'll be into 500 people who would have been trained in mental health first aid here at the institution. And that's been done over the last, 5-6 months, I guess. And Christine, I should make special mention to Christine, who is our mental health trainer and who delivers those services very enthusiastically for us. But interestingly, local businesses and other non-sports providers have now contacted us to do the training at Edge Hill with students and indeed with other service users. So I think that is quite important. There is a presence, and to share those ideas across the sectors is also quite useful. That I think certainly some of the reflections that I had, but I do think that there are doubtless other reflections that we can offer. I'm conscious that we've reached 5:30. If colleagues have specific questions about the partnerships that we've developed, then of course myself, Johnny from Everton, and Mike and Chris, Simon is still here from Calm, as well as Mark. We would be keen to answer those questions. I'm sure people could do with a short break and a drink. So what I will do is close by saying thanks very much for staying the course. I do feel like the last match of the day, or even the first game in the Football League show at 3:10 in the morning, and you've all stayed awake because you feel as if you ought to, even if you didn't want to stay. But we will be serving refreshments and canapes before people leave in the garden restaurant, which is just out of the double doors here to your right, and doubtless colleagues will be able to point you in the right direction. I'd also like to thank, of course, all the speakers who have given their time freely today, and to make this as accessible as possible to as many people as possible. I'd also like to thank the students for wearing their blue shirts, branding, but also for running around with microphones that crackle. But also to the department and to the institution that continues to fund the impact-related work that we do. And I'll leave that there. Say thanks very much for attending, and please do help yourself to a glass or two of wine or orange juice if that's your preference. Thanks a lot.